And our next speaker is Rachel Lindeback, who is a senior paediatric dietitian at Sydney Children's Hospital. And she's going to talk about food, fabulous food.
Yes, so thank you for having me. This is a great privilege to come and chat to you today about food. While we're loading it up, I'll just give you a bit of a background of what I do. So I'm a paediatric dietitian. So I work at Sydney Children's Hospital with some of our team members are here. And pretty much I've worked in the neuromuscular team for the last few years, and it's an area of great interest to me. And so what I'm talking about today is food and how that impacts on you with a diagnosis. So I wanted to call it Food, Fabulous Food because I love food, and I think something that sometimes we can get into a bit of a pattern of is being an enemy with food. And so I wanted to go through today... what does a dietitian do, and general principles of healthy eating. Once you have a foundation of what are the general principles, it's really easy to then build from there and tailor exactly what your nutritional concerns are, and understand why dietitians do what we do. So then I'll talk about weight management and nutrition support. So dietitians don't just laugh at salad, which is one of the misconceptions. You can see the picture up there. So we're not all about just trying to be the food police. That's something that people talk about a lot as well. Our role is to try and make sure that the nutrition that your body is getting is enough for your body to function optimally. So if you don't have good enough nutrition, there's so many things that can be impacted by that. Our primary indicators are weight and BMI, so that's a really objective measure, dietary quality and nutritional bloods. So they're the things that we're looking at when we're assessing a diet. So you might need to see a dietitian if you have issues of weight. So that's either overweight or underweight. And I've put the calculation of how to calculate your BMI up there. So BMI is weight over height squared, but it's height in meters. And so your categories are a BMI above 25 is considered above the healthy range, and under 18.5 is considered under the healthy range. For kids, it's a little bit different. So we don't just use the raw measure, we actually use a growth chart and plot it on the growth chart. But that can be a good indication. And of course, there are things, people often talk about the issues with BMI, and there certainly are issues with BMI, but is a good preliminary assessor to tell us whether you might have nutritional issues. You might need to see a dietitian if you're going to have planned major surgery. So there's a lot of evidence to show going into surgery, if your nutrition is even if actually a lot more nutritional research is coming out to say if you're actually above the healthy range, that your risks are actually similar to if you are underweight. And so you might want to then, going into surgery, plan to have your nutrition as good as possible. There's also a lot of things in your nutrition that can help you to heal well after surgery. So if you are zinc deficient, iron deficient, low on protein, it can make it really hard to recover after surgery. So we have a look at that. If you have difficulty with chewing and swallowing, that's primarily actually a speech pathology area, but we're concerned about it because it makes it really hard to get enough nutrition in. Need for texture modification and thickened fluids. So if you've got issues with your swallow function and you have to have thickened fluids, it makes it really, really hard to get in enough fluid in the day to keep you hydrated. And they've shown, particularly in older Australians, that one of the biggest causes of a decline in cognitive function is actually dehydration. So dehydration is a really important thing. And steroid use. If you're on steroids, you should be getting at least an annual dietetic assessment, and I'll go through that a little bit in more detail. So these are the red flags that we kind of look at, and that maybe if you're thinking of, do I need to see a dietitian, these are the red flags. If it's taking you a really long time to eat, so more than half an hour is considered normal. If it's taking longer than that, that's quite a long time. Dehydration, constipation, they can be related to other things as well, but they are some flags. Food refusal is when you kind of get to the point where you're going, I don't really want to eat meat because it's just too much work, or things are just becoming really hard to chew. That's the primary reason that we see that. Noisy breathing, inspirational stridor. There's lots there, excessive weight gain or weight loss. A really big flag actually is if, even if you are overweight, if you start losing weight without planning to, that's actually quite a concern. We want to make sure that we know the reason that you're losing weight. Oftentimes people will get really excited about the fact that weight's dropping off them and they haven't planned it, but actually we get a little bit concerned about that. So how often do you need to see a dietitian? Really depends on what your specific condition is and what your concerns are. Usually it's 1 to 2 times a year if there are concerns. If you are gaining weight or losing weight really rapidly, you might see a dietitian more frequently just to try and get that under control. But your doctor should actually be doing that monitoring, every visit to make sure, and you should just keep something to keep an eye on, is where your weight is heading. And for the steroids, like I said before, you have to get a vitamin D check annually, or should get one, and an annual assessment of your calcium intake. So we know that steroids impact on your absorption of calcium, and so seeing a dietitian to actually check that you're getting enough is really important for bone density. And it might be that you get put on a supplement, or ideally, if we can get more in your food, then we'll just aim to do that. So this is what we do when we're looking at a diet. So you can see on this diet, we've put it through a food analysis program called FoodWorks to spit out exactly what nutrients are going into your body. So for this particular patient, their energy intake was quite low. So they were losing weight and it was reflected in their food diary. Their iron intake was really low and they weren't actually iron deficient yet, but they were on the path to iron deficiency. And fibre intake was really low, and constipation was an issue for this patient as well. So being able to analyse exactly what was happening, we were able to see areas for improvement. So we do check nutritional bloods, so that's another kind of primary indicator of whether there's issues of deficiency, because as much as I can look at your diet and say you're not getting enough, according to RDI, RDIs are actually a spectrum. So there's some people who need, the RDI exactly, but there are some people who actually don't need that much and they maintain their levels perfectly fine. So we try and get objective measures where we can. And it can guide our supplementation. So we might think that you're iron deficient based on symptoms and how you look. So you get pale and lethargic, and it can be really hard to do things that you previously could do easily, which can be difficult if you've got a condition that causes fatigue as well. But if we suspect it, then we need to actually check how deficient are you and then supplement accordingly. So some symptoms of deficiency, these are very brief, I guess. There are a lot more symptoms of deficiency than just these ones, but low iron and low vitamin D can cause lethargy. So as I said before, it can be really difficult depending on your condition to kind of tease out what is just, standard, what's normal for me, and what is actually a deficiency. And if it actually is that you're deficient, your energy levels could pick up with supplementation. Low zinc can delay wound healing, so I mentioned that before, and it increases your risk of infection as well. Low B12 can cause pins and needles. So actually my sister-in-law, she told me her symptoms and she told me her diet, and we figured out that she had vitamin B12 deficiency just because she had pins and needles all the time. Just when she was sitting watching TV, she'd just all of a sudden get pins and needles. So if you do get that, see a doctor. Low vitamin A can cause night blindness. So if you start to lose your night vision, we've had some kids who have actually, this one particular kid lives on noodles. And so we actually checked his vitamin A because we were quite concerned about it. And when we actually then had a look at how his eyes were functioning, it became quite apparent that he had quite significant impact on his sight because of his vitamin A deficiency. And low calcium can cause brittle bones. So there's lots and lots. That's a very abridged list, but that's why it's so important to make sure your nutrition is good so you don't run into any of these problems. So what is healthy eating? Healthy eating is a little bit fraught in the age of social media and technology because there's so many opinions and everyone has a platform. And so it can make it really confusing to know, what am I actually meant to be doing? Are eggs okay? Are eggs not okay? there's just lots of those kind of food myths. But food is a lot more than just nutrition. It's so much more than that. It's cultural, it's social, and it's enjoyable. And sometimes when we're talking about, putting people on diets, or people go on crash diets and different things like that, that's something that we miss, is the fact that it's not just about nutrition, and you have to take all of that context into it as well. So these are the principles of healthy eating. And so you're trying to, I guess when I talk to people and patients, I'm trying to incorporate, okay, what's your social background, your cultural background, your attitudes toward food, but we still need to make adjustments. So this is a very helpful guide to what you should have on your plate at mealtimes. So you should have half of your plate as vegetables. A quarter of your plate should be protein, and a quarter should be carbs. So in Australia, it's kind of flipped. So we have about half a plate of carbs, definitely less than a quarter veg, and quite a lot of protein. So in Australia, we've kind of flipped everything around the wrong way. This is the Australian Guide to Healthy Eating, which you would have seen, no doubt, around the place. It gets a lot of criticism, but I'm going to go through why I think that's unfounded. So essentially, within the circle are all the foods that are going to do lots for your body. So they're the foods that you need to eat every day to make sure that you get enough of those nutrients to avoid deficiency, and also for your body to just work well. And then things outside of that circle are discretionary foods. So they taste good, but they don't do much for your body. So we try to talk about it in terms of everyday foods and sometimes foods. So putting a moral value on foods, we try and avoid. So there's no good foods and bad foods. It's all just food, and it's all enjoyable. But there are foods that you need to eat every day to make sure your body functions well, and the foods that you don't need to eat very regularly. You don't actually need to eat them at all, but you might choose to for enjoyment, and that's fine. So this is probably a bit hard to see, but if you're interested in really looking at the details of how many serves of different foods you need in a day, you can go onto the Australian Government website. So just type in Australian Guide to Healthy Eating and it will come up. So this is the reason that I think the criticism of the Australian Dietary Guidelines is unfounded, because certain people in the media will often talk about the fact that obviously the dietary guidelines are bad because everyone is getting more and more overweight. We're seeing more and more deficiency, so it must be rubbish. Less than 1 in 25 Australians, that's hardly any, 4% of Australians eat enough vegetables and legumes. 1 in 25. It's not much at all. So people aren't actually following the recommendations. 1 in 200 Australians aged 18 and under eat the recommended minimum for vegetables, 1 in 200. So our kids, no one is eating enough vegetables. 1 in 3 of Australians get enough, 1 in 10 get enough dairy, but 1 in 3 of our calories, like 1/3 of our total calories, is coming from discretionary foods. So that's across Australia-wide. So 1/3 of our calories is coming from foods that don't give us any nutrition. So it's a huge issue, I think, to be blaming the Australian Dietary Guidelines for our lack of nutrition when we're actually not meeting them. So we are closer to meeting fruit, grains and meat. However, 1/3 of our fruit serves generally come from juice and dried fruit, so not super high quality. And 2/3 of our grain serves are from refined grains, so like white bread and highly refined starchy things without fibre. So if you're going to do anything, try and get your diet to look more like that. So a good principle is that your meals should be based in the fridge and not in the cupboard. So if most of your foods are in the cupboard to make the foundation of your meal, there's a good indication that you're not getting enough of those fresh foods, so particularly vegetables, to meet the guidelines. And opting for whole foods where you can. So I like to say you opt for foods with one ingredient. So a banana has in it a banana. or an orange has in it an orange, or a carrot has in it a carrot. The foods that have lots and lots of ingredients and lots of preservatives and additives and things like that are generally discretionary food items. There are some exceptions. So breads and cereals will have more than one ingredient. They will often have yeast and a little bit of salt and water and things like that. Cheese also has culture in it, and yogurt. So they're the exceptions. They're very healthy foods to have that have more than one ingredient. But you can see if we go back to this, most of those foods are one ingredient foods. So we might have a little bit of a quick look at label reading. So what are you actually looking for? If you are going to eat those packaged foods, what are you trying to aim for? Something that is unfortunate is that we tried to come up with a star system, or a government tried to come up with a star system to rate how healthy foods are. Gummy bears get 3 stars and some yogurts get 1 star. And as much as the yogurts might have sugar in them, I would much prefer you to have a yogurt than I would gummy bears. It's not a great snack. So you need to kind of obviously use your common sense as well when you're looking at these things. So try not to be guided too heavily by the star system, because it's got a lot of issues. But with your label reading, you're aiming for 2 grams per 100 grams or less of total fat. And the trans fats should be labelled, and you're aiming for less than 1 gram per 100 grams. In Australia, they've actually got fairly strict laws about trans fats now, because we know that it causes macular degeneration. So we're fairly strict on that. Sodium is a massive one. So when you're looking at a label, you always want to look at the per 100 gram column. And when you're looking at that, your best choice is less than 120 milligrams per 100 grams. It is very difficult, you will find. Good choices are 120 to 600. A disclaimer is that bread will always sit at about 400. That's okay. If you're having, some bread products that sit in that range, that's fine. But a poor choice is more than 600 milligrams. And I was going through this with a patient the other day, and we decided to have a look at a few things in our cafeteria. And there were, I think it was burger rings that were 1,200 milligrams per 100 grams. So if you're thinking we're not going over 600, we've doubled it. And pretty much with your sodium, if you have issues with your blood pressure, you really need to keep your sodium intake down, because what sodium does is it draws water into your blood, and so it puts your blood pressure up. So we try and keep your sodium as low as possible. So with people with like hypertension or heart failure, we really say you have to try and keep as much as possible below 120 milligrams per 100 grams. And it also means trying as possible not to add salt into your food, or really salty sauces. So soy sauce and things like that are very, very high in salt. What you'll find initially is that everything will taste really bland when you try and start cutting down your salt. It takes about 2 weeks for your taste buds to adjust. So once your taste buds have adjusted, things that previously tasted, normal and just tasty, if you try and eat them again, it will be really hard to handle. So when I did it I tried to eat everything under 120 for 4 weeks, because I was doing heart failure at that time. It was really hard, but I did it. And then when I went back to try it, I think I had some chips or something as an experiment, and it was, I could barely eat them because they were so salty. So your taste buds will adapt. But in the meantime, you can use things like herbs and spices, garlic, ginger, that kind of stuff, to boost the flavour of your foods, to make sure that you still want to eat it, because food is enjoyable. It should be enjoyable. Sugar, so you're aiming for 15 grams per 100 grams or less. An exception is things with fruit in them. So this, like the Morning Sun muesli, has dried fruit in it. So if it's got dried fruit in it, you're just aiming for less than 20 grams. And fibre. So fibre, you're aiming for 5 grams per 100 grams or more. So these are a lot of things to try and remember when you're reading a label. There is actually a handout on a website called Baker IDI. If you write that down, it has a really helpful, just 1-page, how do I read a label? And it's actually where I pulled all of these from. So you can go and get that and then take it with you shopping. But as I said before, sometimes it's about looking at the food product in general, and trying to make a call about the quality of that food product overall. But these can be, I guess, a guide to help you make that choice. Limiting added sugar is a massive thing for particularly teenage boys, but in general, for healthy eating. So the average Australian should have no more than 50 grams added sugar per day, and that's 12.5 teaspoons. That's still a lot, but we should have no more than that, particularly for our teeth. Aussies average 14 teaspoons a day, so it's 22 kilos of added sugar per year. Male teenagers, 14 to 18. I don't know if any of you guys have teenage sons or you're teenagers yourselves, but you see them carrying around those big 2-litre things of juice and, unfortunately, energy drinks, which I hate. But on average, they have 22 teaspoons a day of added sugar. So keeping in mind, 12.5 is what we're definitely under 12.5. And the top 10% of that group consume at least 38 teaspoons a day of added sugar. It's a lot. So things like Coke, you can see each of those cubes of sugar represents a teaspoon, and you can see how much sugar is in all of those different foods. That is from a website called Sugar Stacks. So if you want to go on and have a look, so keeping in mind 12.5 is your number under that. If you want to go on sugarstacks.com, you can actually look how many sugar cubes, how many teaspoons are in certain foods. Another one that people find very disappointing is Boost juice. Is actually, if you look at you might not be able to see it, it's a little bit small, but on the other thing, how much sugar is in that drink, I think, I can't actually read how many it is from here, but it's a lot. So that's a Mango Magic. 12 and a half. So people think that Boost juice is a really good option and that it's really healthy. Actually, it's got a lot of syrup and added sugar. And so unfortunately, actually the Mango Magic Boost juice has similar amount of calories to a Big Mac meal. And so unfortunately, you might think that you're doing a really great thing by avoiding having, some other little, like a donut or something, and you go for a Mango Magic or a different Boost product. And unfortunately, sometimes you can actually be shooting yourself in the foot. And that's unfortunately what we're seeing with a lot of these new health foods. They're great because they're quite high quality in terms of they're full of nuts and dates and lots of different things, but the amount of calories in them is quite phenomenal. So something to keep in mind. You can go online. There's heaps of resources about how to eat more fruit and veg. So this, it's also very hard to see, but if you just Google, there's so many lists of how to incorporate more fruit and veg. And one of the best ways is just having a bowl of salad, particularly going into summer, on the table and serving yourself a small meal. Because then, if you have social meal times, which is, as I said before, meals should be social, food should be social. Picking things is kind of a fairly common thing when you get hungry. You start to just pick on the salad while you're sitting there. So weight management. So weight gain can be really hard to manage for lots of reasons, but it can be due to steroid use. It just puts your appetite up, and it's an unfortunate side effect. Decreased muscle mass also makes it a challenge. So the amount of calories that you need as a baseline is actually lower because you don't have as much metabolically active tissue. It can result in the ability to use standard equipment. So particularly if you're gaining weight really rapidly and you find that you're growing out of your wheelchair or things like that, it can make it really difficult. And it does limit mobility. So if you think that if for every, let's say, 2 kilos you gain, it's like carrying around an extra 2-litre thing of milk a day, and that's just more and more weight that your muscles are having to take. It's still a matter of energy in, energy out, though. So we still can do things to try and mitigate the weight gain. And the goal is weight stagnation initially. So some people will say, okay, I'm going to lose 5 kilos in 5 weeks, and that's going to be fantastic. Usually what we find is that it's not sustainable, because you go really hard, you have a lot of enthusiasm, and then you get a stick of carrot sticks and you fall back and everything kind of falls apart, and then you end up gaining more weight than you started with. So actually the goal initially is, if you're gaining 1 kilo a month, aim to gain half a kilo a month, and then 250 grams, and then no weight gain, and then go down from there. It's trying to actually do things in a stepwise way to make sure that you can maintain it. So we have talked about steroids, and So the difficulty is that overeating tend to lay down fat tissue rather than muscle. And it needs a whole family approach. So if in your house you have lots of discretionary food items, so those non-core food items, it's going to be very hard to use your willpower to not eat those foods. So sometimes it's actually a matter of going through your pantry and just chucking it out. So that when you're really hungry and it's 11 p.m. and you tend to snack late at night because that's your pattern or whatever, there's actually nothing there to then eat. So then you just have, whatever healthy alternative you bought in a moment of strength. And I guess the other thing is, don't go shopping when you're hungry. Going shopping when you're hungry, you'll always come home with rubbish, and way more than you need. So try and eat before you go shopping. Distraction is a good one as well. So you might decide, like, I need to go out to the park, or I need to go for a walk, or I need to go out and do the shopping, or I need to go and do something else just to get you out of the house. And I think the other thing with distraction is that sometimes you think, if you're trying to think so hard about, don't eat the chocolate cake, all you end up doing is thinking about the chocolate cake all day. And so then you want it even more than you would have if you'd just been trying to think about something else. So trying to not think about the thing that you're not eating is a good strategy. Drinking, yeah, good question. The practicalities are a little bit more tricky than this, but drinking water with and between your meals, and plan for snacks. Planning for snacks is a big one because what tends to happen is you go, okay, I'm going to, my meals are going to be great and, they're going to be fabulous. I'm going to do all these things. And then you get peckish in between and you think, oh, I'll just have a packet of chips, or I'll just have some lollies or whatever. So you need to plan to have snacks. This is a fact sheet that we use at Sydney Kids. You can go on the website and get it. It's lots and lots of snack ideas from core foods. And nutrition support is the last one I will go through quickly. So nutrition support is for people who are underweight or need to gain weight. And it can be a result of lots of things. There could be lots of reasons that you're struggling to keep your weight on. But essentially, we want to use the healthy eating principles. We don't want to put you on a junk food diet because, like I said before, then you'll run into nutritional deficiency. So we want to keep your healthy diet, and then we want to add calories into that. So we put in oils, we put in butter, we put in cream, we put in cheese, things like that. But we still want it to be nutritious. And there's lots of ideas. Another fact sheet that's on our website. This is obviously for children because I work in children, but the ideas apply, and there's heaps of ideas. So if you get sick of one thing, you can move on to another. We can put you on a supplement drink, which pack a lot of calories. And then the last thing to say is tube feeding is then an option if you're finding it really hard to keep your weight on, or you're struggling with your swallow function or things like that. I think it's something that, particularly in pediatrics, can be very scary for parents and a very scary step. And for adults as well, it's a scary step to take. But actually, it's a really straightforward procedure. And about 95% of my patients who've had a gastrostomy have said after they've had it that they wish they'd had it sooner, because it just takes so much pressure off. And like I said before, food should be enjoyable. So if it's not, then doing this can take the pressure off and then help you to enjoy mealtimes again. And if you're concerned about your nutrition, chat to your doctor. They can refer you to a dietitian. If you are in that category of people who are on steroids and there are concerns of your bone density, just chat to your doctor about seeing a dietitian proactively. And yeah, I love food. I hope you do too, and I hope you've learnt a little bit more about it. And yeah, all of those resources, as I said, Sydney Kids Hospital website, there's some on there. Baker IDI has the label reading one. The government has heaps of resources, so you can always go onto the Australian Guide to Healthy Eating. Thank you.
What's Baker IDI?
I don't actually know what the organisation is.
The website?
Yeah, it's the website. Yep, BAKER and then the letters IDI.
Does anyone have any questions for Rachel?
Just one open heat.
Oh, well, wherever you like now.
Okay. That's good. Okay, so you know me, I've always got 3, not 1. So the first one is like for people with particular like myopathies and dystrophies, etc. An increased protein intake is not necessary?
No.
No
In
benefit?
Australia, we actually tend to overeat protein. But what we found is so long as that people with muscular dystrophy are getting their RDI, getting above that doesn't actually give you more muscle mass.
Doesn't help?
No, it just converts to fat tissue. So the main thing is a positive energy, neutral energy balance. So you want to make sure that you've got enough calories going in, that you're not burning through your muscle, because that is a risk when you're losing weight, that you're actually losing muscle. But no, extra protein hasn't been shown to be beneficial.
So one of the things is that often with myopathies and that you have like an increased CK levels, which just is recognising that the muscles
Yeah.
working harder.
Yeah.
Apparently like you're running a 10K run,
Yeah.
even though you're not, just saying. So therefore, again, that excessive protein, you know what I mean? There's no
Yeah.
way to support that, decrease it, help anything that's going to make it worse, just by
The
food?
main thing that makes it worse, or I guess muscle, in terms of the muscle weakness side of things, is weight loss, and also excessive weight gain in terms of the amount of stress on your muscle.
Yeah.
So you've got a lot more stress on your muscle if you're having to, I guess, let's say when you're moving your arm, it weighs 1 kilo or 2 more than it otherwise could. But yeah, in terms of eating protein, so long as you're getting your requirements, then above and beyond that.
Okay.
But
So-
most
so-
Australians do get above and
Okay,
beyond.
so any of the supplements that they have, the L-carnitines and, you know, where creatine and...
Creatine, yeah. So in terms of
Yeah.
creatine, they're actually doing a study down in Melbourne, which I'm waiting to hear the results of. They were looking at creatine, and we've seen there are some benefits to using creatine, but they've done this big study to see exactly what the benefits of that and some other supplements are. So I'm actually waiting on that at the moment, but we don't routinely prescribe creatine.
No, like often people are saying, you know, okay, well, your muscles are breaking down, so therefore, you know, if you were a bodybuilder and you were working out, therefore have the creatine and that supports the muscle to mend.
Yeah.
Pardon?
We've started to do that a bit more.
Yes.
Just, as you say, there's a trickling of evidence
Yeah.
coming out. As long as it isn't too expensive. and
That's
it
the
doesn't do
thing.
any harm.
Yeah, that's
It's not going to hurt, even though you've got like an increased CK level. It's
Yeah.
not going to hurt.
No.
No?
And that's the thing that I think, we want to look at as well, isn't the cost-benefit ratio. So sometimes there are things that are just so expensive that the amount of benefit that you would get from it, like, we don't know. And so sometimes that money can be spent elsewhere. But if it's not that costly, you can always give it a go and, yeah.
The loss that you have, you know, it's a science experiment.
Yeah.
You don't know until you
No. Yeah, give it a go. Exactly, yeah.
The physical benefit.
Yeah. Yeah. Yeah.
I just have just these two, and then
Oh, okay.
probably move on because
Then
Yeah.
Sharon's next.
Sorry, thanks, Rachel. Interested in keeping on top of the latest proper research
Yes.
with nutrition.
Yes.
As you say, there's lots of beautiful Facebook posts.
Yeah.
But what would you recommend in terms of, and I don't mean for the general public necessarily, but
yeah,
keeping
yeah.
on top of the research
For nutrition.
You know, for this creatine study, for example, I know there's quite a bit going on with vitamin K for its
Yeah.
protective effects on
Yeah.
hearts,
Yeah.
which is quite exciting for some
Yeah.
dystrophies. So what would your recommendation be?
So what we do is, or what I have set up is actually a literature search. So I just have a running literature search for and alerts that come up for nutrition related topics and muscular dystrophy. So that's actually one of the main ways that I keep up to date with what's going on. Other than that, in terms of general nutrition, PEN is helpful. PEN is PEN. I don't know exactly what it stands for. But if you look up PEN Nutrition, they always are sending out updates on current nutrition advice and recommendations and research. But yeah, I just set up a literature search on it. So nutrition, you can put in the keywords, nutrition, muscular dystrophy. I've got in there a couple of the specific conditions that I'm interested in. So SMA, myotonic Duchenne, and then putting in as many of those kind of nutrition words as you can, but usually because they're all nutrition related topics, so you can put in vitamins and supplementation and things like that you should get them through.
So you just put it in your server. Sorry, I think you should search just.
Yeah, so I've actually got one with our library, so at our hospital, but yeah. Yeah.
Go to Google and just go Scholar. It'll come up with that website, and a different aspect of Google, and you might be able to set up a search.
Yeah, and it's just a standing search, so you get alerts.
Thank you for your talk.
No worries.
Is it true that if you've got a low sodium level and you don't have much salt in your food, that you should reduce your water or liquid intake? I've been sort of told that. And,
Yeah. So in terms of sodium on bloods, usually, is that what the issue is? Like your
very
blood sodium?
128, like very low sodium.
Yeah.
They tell me to reduce my water intake to about 750 mils per day.
Okay.
And in summer, I feel as though I'm not getting enough.
Yeah. I can only speak to paediatrics and what we do in paediatrics. I'm also a paediatric renal dietitian, and what we do when we have low sodium on bloods is to actually supplement with sodium. But I don't know in your specific situation, so I wouldn't want to tell you to do that. Yeah, chat to your doctor, but yeah, I'm not sure exactly. That's not something that we tend to do in kids, but that could be very different in adults.
Thank you.
Yeah.
One quick thing. I have teenage children and they tell me kombucha solves everything.
Kombucha is fantastic. Yeah, it is actually really good. Yeah.
Because it gets the grain, it's fizzy and it's in a...
Yeah, oh yes. Sorry, I should qualify that. Kombucha, some of them are not great. Yeah,
My daughter showed me the label and said no sugar.
some of them are very like quite synthetic and very they do have lots of additives and flavors and different things. So let's say pure kombucha, in the way it was intended to be drunk, is quite amazing. Yes. Yeah, read the labels. Ah, there you go. Chat to Sandra.